we've seen health workers' unions in KwaZulu-Natal say hijacking of state vehicles, especially in the north of Durban, has been ongoing for some time now. It follows an incident where a male nurse was hijacked and killed. The incident is not the first in the area where criminals are targeting state vehicles. The nurse was traveling with other healthcare professionals to a training session in Durban. A gunman approached them and opened fire, forcing them out of the vehicle before driving off. The union says that nothing is being done to ensure the safety of workers. The health department says that they are looking at ways to increase their staff safety. So for more on this, we're going to be joined by Mpho Mpogeng, President of the South African Emergency Personnel Union. Mpho, good afternoon. Thanks for your time with us here on the SABC at this hour.
Afternoon, and thank you for having me.
Let's look at the reality on the ground across South Africa. And as we look at the safety of emergency personnel, what's been reflected on the ground as we're speaking?
Yeah, basically what one can say is that we've seen improvements there and there, but the very same issue of attacks is actually continuing as we speak. Because some of the provinces are not actually responding to our calls. Remember, most of the state vehicles, are not having trackers, they are not having cameras, they are not having anything. So to the thugs or criminals, they are just easy targets. So we've been preaching this gospel for some time, saying that they must equip the vehicles with all these trackers and cameras and so forth. We've seen only few provinces that actually responded. We're having Gauteng, Free State, and Western Cape. These are the only provinces that responded. If you get into an ambulance in Free State, there are cameras there. The ambulances are monitored by control centers and so forth, and they have a proper communication as we speak. Even though in terms of communication, one cannot be proud and say they're having proper communication because our members are still utilizing their cell phones to communicate or take emergency calls. But other provinces like Limpopo, like Mpumalanga, Northern Cape, in actual fact, Northern Cape is a disaster on its own because we have seen in Northern Cape, people are still using one-man crew where the ambulance is like a taxi. So for the perpetrators, they see state vehicles as cheap or easy targets. So this issue of attacks, if you can check in Gauteng, the attacks are actually reduced to a certain level, even though they are not on zero. But KZN probably is still high. Why? Is because the province, the leadership or the MEC of health in KZN is not willing to engage with us as unions. Is trying to be a monster in that province, is not doing anything. So that is the biggest problem because we have seen so many. Last time when I checked, one of the ambulance crew members was shot, and fortunately she survived. So those kind of incidences are happening in the province, unfortunately, because the MEC is arrogant, is not willing to engage. We've written letters, we requested meetings to actually assist in relation to this, because this thing is not a one-man show. As the union, we are very much concerned because those are our members, and also the community, they are struggling because there are areas where ambulances cannot enter. And in the very same areas, there are destitute community members who are desperately in need of the very same service. We can't stop the service, and we know very well that if an ambulance or any state vehicle can enter into that particular area, it might not come back safe. So
okay.
It requires us.
All right. No. Thank you for those sentiments, because I actually then wanted to ask you, speaking about a lack of engagement from the MEC of Health in KwaZulu-Natal, what's the next step then? How are you going to rectify and address this, particularly as we enter the festive period, given the needs of the community?
You see, it's between heart and it's two sides of the same coin, because we can't say let's stop the service because our members are in danger, while himself is arrogant sitting there. So we're still engaging our leadership in the province from COSATU level to engage them, because ourselves as a union, they are actually undermining us. So we need all the angles to engage so that we can assist each other in relation to this matter. And if a need arises, we need to approach the very same political party that deployed the MEC to remove her, if it's possible, because we can't sit back while people are losing their lives. The community members are desperately in need of the service, and the MEC is arrogant because it's protected by bodyguards and so forth. We can't allow that situation to proceed.
Okay.
So basically, we're doing something about it, and obviously very soon something will happen.
Okay, so we'll monitor developments on that front, and whilst that process is underway, perhaps you could speak to the impact it's had on staff morale and even just the added trauma. What are you observing from a union's perspective?
Yeah, basically, when you talk about the staff morale, the morale is very, very low. Remember, we're from COVID, and our members were on the forefront dealing with COVID. And in the very same province, our members, some of them, they were pushed to respond to COVID cases without any PPEs. So it was very, very serious. And unfortunately, we couldn't even get any token of appreciation from all the MEC. One can ask a simplest question. Why are we actually attacked? Because we are attacked by the minister, we are also attacked by the provincial council, we are also attacked by the MECs, we are also attacked by the community members. It is a sin in the country to be a public service worker because you are always victimized. If there is a shortage of money, the Department of Treasury will just look into the public service. If there is a poor service in the public sector, we are the only people who are blamed. Even though we know in all the clinics, in all the health facilities in the country, you can travel all over in the country, they are accused, but department is not doing anything about that. But the very same people, workers, are blamed by the community because we have seen so many social medias where our workers are treated very, very badly by the community members, and the very same MECs are taking them videos and so forth, victimizing them. So the morale of the workers is actually low because of the very same incidences that we are referring to, because our workers are not getting any support anywhere. They are always traumatized. There is no counseling. There's nothing. They are always pushed around and so forth. There is no token of appreciation. They are getting peanuts. The overtime is cancelled. All this mess within the department is happening, and the people who are carrying who are carrying the blame are the workers. So it is quite disappointing, I must indicate.
All right, so where to from here as a union then? Just very quickly, I have to wrap up, but where to from here in terms of protecting your members? What about gender imbalances? How do you also assist, in readdressing that?
Yeah, you see, the issue of gender is quite a sensitive matter. More especially, I'll be specific and deal with the issue of EMS, because you see, the time when people are attacking in other provinces, they'll say when you crew an ambulance staff or crew members, you must make sure that there is a female and a male. So what is the responsibility of a male? It's not a security guard, so he cannot protect the other female. So it's quite difficult for one to say the issue of gender is properly addressed, because during the night shift, men are used as security guards, but they don't have anything to protect themselves. That is why they are just victims, because when the ambulances are attacked, first person that is going to be approached and shot at is the male, because they feel, or the perpetrators, they are scared because it's a male. So such kind of issues are very, very much sensitive, because you see station managers every time when they crew, more especially during the night, they will actually make sure that they pay or they crew people based on gender, and which is totally unacceptable at some point.